Introducing the CrossFix Meniscal Repair System from Cayenne Medical. An innovative approach to meniscal repair featuring a suture-only device that creates an instantaneous mattress stitch for fast, strong, and reliable all-inside meniscal repair. The procedure begins with assessing the tear and determining its repairability. After portal placement is determined, the probe is introduced to measure the distance from the capsule to the preferred entry point on the meniscus. This distance will be used for the depth limiter configuration. With the depth limiter fully extended, the delivery needles are inserted into the joint space and positioned for repair. Based on the preferred meniscal entry point of the device, the depth limiter is retracted to the desired distance by moving the black lever to the right and then down. The delivery needles are inserted into the meniscus, capturing the tear. The delivery needles will be in position when the depth limiter pushes against the meniscal surface, limiting advancement. With the delivery needles in position, the trigger is squeezed to deploy the suture. The trigger can be released after hearing an audible click. When the trigger is released, the crossing needle retracts, leaving the suture behind. The delivery needles are removed from the knee, and a sliding knot advances into position. The post end of the suture is cut off of the device. The cut white end is the post end, and the curly black end is the locking end. The post end of the suture is pulled, advancing the sliding knot, which reduces the meniscal tear. If the initial reduction of the meniscal tear is not satisfactory, the CrossFix knot pusher suture cutter is used to further reduce the tear. First, the white end of the suture, or post end, is threaded through the knot pusher suture cutter. The suture can be loaded by hand or with the packaged snare. The knot pusher suture cutter slides down the suture onto the knot. Gentle pressure on the knot, combined with firm tension applied to the post end of the suture, completely reduces the meniscal tear. Once satisfactory reduction is achieved, the black, free end of the suture is pulled to lock the knot into position. Half hitches can be added at this point as required. In preparation for cutting the suture, both ends are threaded through the CrossFix knot pusher suture cutter. The knot pusher suture cutter slides down the suture onto the knot. The tip rests against the knot, allowing for a 2 to 3 millimeter tail. Pulling the black trigger cuts the suture. The CrossFix surgical technique offers surgeons a complete solution for meniscal tear repair. The all-inside technique creates an instantaneous 3 millimeter mattress stitch with a single insertion into the meniscus and pre-tied sliding knot. The suture-only device reduces the risk of chondral injury common to implantable plastic devices. The technique is fast and easy, resulting in reliable and reproducible outcomes. The device provides biomechanically strong fixation with pull-out forces equal to open suture techniques. Straight and curved delivery needles allow for easier access to multiple tear sites.